Physiological and psychological response to injury. This is the damage response mechanism. So firstly, you'll feel pain. This is damage to the body tissue initiates a primary damage response mechanism to the brain, which then sends information to the affected area. This is causing symptoms of pain and inflammation in the damaged area. The pain will go to the injury, so this will mean that the individual will know something's wrong, as it will be tended to touch. And it's important to ensure that if it were injured, like a leg or an ankle, that the individual wouldn't be able to move it or walk on it. The next sign is inflammation. So the injured area will turn red and the blood flows, this is because the blood flow will be increased and the blood vessels will vasodilate, so this means they get bigger. This is when, so obviously they get wider because there'll be a greater lot of blood flow going to the surface which will make it red. Fluids will also surround the area, this is for protection. With inflammation, it makes the area less movable. This is important as the individual won't be able to move it and therefore they won't be able to affect it more than it already is. And finally, accumulation of fluid. So once again, fluid will surround the area. So for example, if you've broken your ankle, loads of fluid will go to the area, so this is for protection. Next is the blood clotting process. So platelets are activated by a chemical reaction which turns the blood thicker and more sticky. Platelets build up in the affected area, so where the wound is, and cause blood to clot. Clotting factors reinforce the platelets. The fibrin then acts as glue and pulls the wound together. The scab will then fall off when it is fully healed. As you can see from the photo on the left, on the top photo, you can see where the wound is and the platelets collecting like near the injury. Also there's lots of red blood cells and plasma. The blood vessel will then produce the red blood cells, and which will be the blood bleeding out of your wound. On the bottom photo, you can see the red blood cells and platelets are trapped with the fibrin which acts as the glue, and it makes sure that no more blood will be seeping out. Next, I'm going to talk about intermuscular hematoma and intramuscular hematoma. Intramuscular hematoma is when there is damage to the muscle, causing blood flow within the muscle by the muscle belly. Bleeding doesn't seep into surrounding tissues as the muscle and the epicyamin remain intact. So the bleeding is restricted to go into any other compartments. Intermuscular hematoma, so this is when there's a damage to the muscle causing blood to escape into the surrounding tissues. Bruising can spread into areas where the injury didn't occur as the muscle is broken and the vessels are broken. Both inter and intramuscular hematoma can be superficial or deep. The healing process. So the inflammatory response phase, I've already talked about that in previous slides. The next phase is the repair phase. So the repair phase often happens a few hours after injury and can last up to 6 weeks. So it involves rebuilding the damaged structure and healing the damaged areas. The next phase is the remodeling phase. So scar tissue development will imitate the original structures prior to the injury. So if you look after your scab, you don't pick them, then long-term scarring will decrease and the strength and range of movement will also improve at the site of the injury. Now I'm going to talk about ankle injuries. So a first-degree ankle sprain is when there's pain and swelling, however there's little tearing, and the joint stability is fair and it's quite good. So as you can see in the photo, it's grade 1, it's mild. A second degree ankle sprain is the broadest range of damage, and there'll be moderate to severe pain and swelling. This is because the ankle is telling the individual that it is hurt and they should probably go get it checked out. Also, there's moderate instability. So it means that if you don't do anything about it and you come back, you could easily do it again and sprain your ankle. So it's grade 2, it's moderate. The severe one is a third degree ankle sprain. The ligament is completely ruptured, so this will mean a new ligament will have to be replaced. There'll be severe pain and swelling, so you won't be able to walk on it. The joint is very unstable and other tissues are often damaged, so the tissues around the ankle will be damaged as well. Here are some psychological responses to injury. So the first one is fear. So this is a psychological response to injury because when the player knows that they've hurt themselves, they'll be worried about what they have done and how serious it is. They won't know whether they've done serious or mild damage, or for how long they'll be out for recovery. For example, when Mary King fell off her horse and broke her arm, she didn't know what she'd done to start with, so she didn't know how long she's going to be out for, whether she'd be out for the whole year or whether it'd just be a couple of weeks. Also, there's isolation from teammates. So as well as there being a physical side to sport, it's also about a social side. When a player is injured, they won't see their teammates for a few days or weeks, so there's no social aspect. So for example, in basketball, Mo Williams is out for the whole season. This means he wouldn't be able to see his teammates at all. Also, decreased confidence. So the player would lose confidence when they come back to their sport because they'll be worried to repeat the same injury and be out for another 6 weeks. For example, Jeremy Lin was out for a hamstring for 6 weeks. Anger as well. So if it was an external factor, so something out of your control and something out of the player's control, they'd be angry as it wasn't their fault. So, for example, Maya Darius, who's a hockey player, was tripped as a result and was out for 8 weeks. Finally, motivational issues. So, individuals find it hard to get back into their sport as they feel like they're going to do the same injury over and over again. Also, if they're out for the whole season, like Chris Bosh, they'll get really bored at home and may have no motivation to carry on in their sport. So, psychological responses to injury. So, with anxiety, once an injury has occurred, the individual may become anxious, and when they play again, they'll be thinking about what they've done and think about doing it again. And in turn, it makes it harder for them to play, so it reduces their confidence, and in turn will reduce their skill. A way to overcome this is to listen to music before a match, so this gets the individual in a zone. Another way to reduce anxiety is imagery, so imagining that they're scoring the winning goal. Need for motivation and use of goal settings are very similar because when you set a goal, it has to be achievable and realistic, and if it isn't achievable or realistic, then motivation will decrease as they're not getting any better and they won't be able to reach their targets. Therefore, short-term targets should be set, so this could be weeks, or so it'd be 1 week or 2 weeks, and set a goal for each week, and then they can see if they're getting better, but it should be small achievable targets. Frustration is another response to injury. For example, when Henry Slade broke his leg, he was very frustrated. However, with rehabilitation within the first week of the break, meant that he was able to get back onto the pitch within 8 weeks of the injury. ACL is the anterior cruciate ligament. It's one of a pair of cruciate ligaments, the other being the posterior cruciate ligament in the human knee. Anterior injury often occurs when the biomechanical limits of the ligament are exceeded. When the ACL is done, there's a popping sound at the time of the injury, the knee swelling up within 6 hours of the injury, and pain, especially when you put weight on the injured leg. So Ricky Rubio went down with an ACL injury and was out for the whole season. So firstly, the knee was swollen within a matter of minutes, and there was extreme pain from the whole knee area, so it also became less movable. This was important because the knee didn't want to be moved too much. Psychologically, he knew he'd been badly injured, therefore he was in fear and concern of what he'd done. He'd done a grade 3 sprain. So this type of sprain is most commonly referred to as complete tear of the ligament. The ligament has been split into 2 pieces basically, and the knee joint is unstable. The ACL ligament can be injured in several different ways, so changing direction rapidly or stopping suddenly. So this is what he did in turn to cause his injury. So rebuilding the ligament, most ACL tears cannot be stitched back together. To surgically repair the ACL and restore the knee stability, the ligament must be reconstructed. So the doctor replaced the torn ligament with a tissue graft. The graft will act as scaffolding for the new ligament to grow on. Grafts can be obtained from several different sources, so often they're taken from patellar tendon, which runs between the kneecap and the shin bone. There's also hamstring tendons at the back of the thigh. These are common source of grafts, but sometimes a quadricep tendon. After surgery, physical therapy first focus on returning motion to the joint and surrounding muscles. So this is followed by a strengthening program designed to protect the new ligament. This strengthening gradually increases the stress across the ligament. The final phase of rehabilitation is aimed at functional return tailored to the athlete's sport, so in this case basketball. So before the surgery, RICE, so rest, ice, compress, elevate, can be applied during several weeks ahead of the surgery in order to reduce the swelling and the pain, to attempt full range of motion and decrease the joint effusion. So this will help the patient to regain better motion and strength after the surgery. Pre-op therapy also encourages strengthening of the quadriceps and hamstrings, and a range of motion exercises should be included. If there's no pain involved, then there should be certain exercises done. So after surgery in the first week, a regular icing and elevation should be used to reduce the swelling. The goal is a full extension of 70 degrees by flexion by the end of the first week. Also, week 3 to 4, the patient must try to gently increase the stance pace in an attempt to walk with one crutch, with good hamstring and quadricep control. So the use of the crutches can be reduced earlier if need be. The next athlete I'm going to talk about is Mary King. So when she was riding the horse, it bucked her off and she fell and landed on head first on the back of her head. Her head went forward sharply and she broke her C5 vertebrae and strained ligaments at the back of her neck. When she'd done it, the pain was between her shoulder blades, and as soon as she'd done it, she felt a tingling in her arms and her fingers. However, she was back riding again after 10 weeks of the surgery. She did require surgery to realign the bones in her neck as they were out of place. As soon as she'd done the injury, her neck wasn't able to move and she had to support it with her hands. Also, between her shoulder blades it was tender to touch. These are physiological responses. Psychologically, she felt anxious as she hadn't realised how bad the injury was or what she'd done. However, it didn't decrease her confidence when she was back riding.